Hi, my name is Dr. Mark Sherrod, speaking to you here from NYU Langone in New York City. I wanted to tell you a little bit about our HCM program and also tell you about our staff. So all we do is take care of HCM patients, and we've seen about 2,500 to 3,000 since the program began about 32 years ago. I'm fortunate enough to have a gifted surgeon who works with us, Dr. Daniel Swistel, and I guess I'll tell you about him first. So not only is he good with his hands and technically skilled, but he's also very smart and has come up with some great innovations, particularly for patients who need to have something done for their mitral valves, as well as extended myectomy. The idea is to prevent SAM from recurring. And sometimes it's important to shorten the mitral valve. And towards that end, he invented the plication procedure for the mitral valve, the horizontal plication, and more recently has excised the very tip of the mitral valve in patients who need it, which are about 40% of the patients who have myectomy at the same time. We believe that the combination of the two procedures together is an important adjunctive combination to get good outcomes, not only at rest, but with exercise. Dr. Daniel Macera is my medical colleague who sees patients in parallel with me, who's been with us for 4 years. And Daniele is both meticulous, careful, and extremely patient, going on at great lengths to answer patients' questions and to explain options for them. From a research point of view, his paper on mitral annular calcification as a contribution to SAM is pretty much of a milestone, understanding how that particular pathology can contribute to obstruction. He's also led some of our industry drug studies here, investigating novel treatments. Nurse practitioner Maria Reuter was an ICU nurse before she came to us. So you can imagine she's pretty much unflappable, as well as extraordinarily empathetic, and has been investigating as a leader the benefit of weight loss for our HCM patients, and in our IRB-approved study has now enrolled 55 patients, looking not only at symptom benefit, but also wall thickness improvement. Nurse practitioner Woon Woo came to us from the electrophysiology lab here at NYU, and so she is extremely experienced at atrial fibrillation, which can occur in about 25 to 30% of HCM patients. She worked under the tutelage of our lab director, Dr. Larry Chinitz. And when we have a patient with arrhythmias, she knows what to do and how to help the patients, so it isn't reinventing the wheel. We have 3 research coordinators. Isabel Castro Alvarez came to us from working as a research coordinator at the Bellevue Emergency Room. If you can imagine what it's like helping homeless people in that emergency department. I think it helped her focus and avoid distracting interference, which has come in extremely handy here in her lead of our drug studies. Isabel has to pay extraordinary attention to detail in documenting the activities of and improvement of patients who receive the investigational drugs that we have been fortunate enough to study. Elizabeth Edelstein was a college student at Hunter when she first started to work for us, and she's in charge of our registry and also some of our investigator-initiated trials. And She did such a good job as an undergraduate that we hired her directly out of college, and she's done a bang-up job in these studies of investigating our own independent ideas. Richard Scher has joined us more recently. Richard worked as an investigator at another hospital in Manhattan, but was a phone researcher and indicated that he wanted more personal contact with patients. And he started to develop that skill here at NYU, where he's meeting with patients as they come through our center. As far as office staff, if you're here, you'll meet Christina, Zeta, Crystal, Wanda, and Sandra, who I hope you'll find to be as sympathetic as we think they are. In summary, in any great adventure, if you don't want to lose, victory depends on the people that you choose. So if you're a patient of ours now, great. If you want to see us in the future, please call us and we'll try to help. Thank you. Bye.